Hi, my name is Dr. Kate Brady and I'm here to tell you a bit about the work that the University of Melbourne has been doing with the National Mental Health Commission. In 2020, the National Mental Health Commission asked the University of Melbourne to help them do a study looking at the impacts on mental health and wellbeing after disasters. The National Mental Health Commission was able to recruit Leanne Atkinson and Pat O'Brien to go and ask people about their stories about what had happened after disasters in the areas that they are living in. Pat was able to talk to people in Queensland, in both Townsville and northwest Queensland, and Leanne talked to people in the bigger Eurobodalla area. They talked to 26 people over a range of ages between 30 and 70 about their experiences after disasters. The University of Melbourne was then able to help Leanne and Pat compile all that information together, analyse it, and put it into a report that has a series of recommendations and key findings. With the key findings, the first one was that aftermath-related stressors were really a significant burden for people who had been impacted by disasters. So if we think about the stress that comes from experiencing the hazard of a disaster as being one thing, and then that leading on to a whole bunch of secondary stresses. Those secondary stresses were things like access to housing, trying to manage insurance, health issues that had come up after the disaster, and trying to access support services. Having to negotiate all of these at a time where they'd been through a really stressful event had a really significant detrimental impact to the mental health and wellbeing of the participants that were interviewed. The second one was around the importance of addressing practical needs. So those stresses that I was just talking about, those accessing housing, dealing with insurance, trying to access support services, where people found it really difficult to get support was around addressing those practical issues. So where the practical issues were addressed, the stress was really reduced. Where it wasn't, the stress was really increased for people. The third key finding was that the post-disaster environment caused a lot of strain on the relationships for participants. These were the relationships, things like with their partners, with their children, with their siblings, and with colleagues and other friends. And one of the reasons that's really important for us to recognise is that it reduces the natural recovery supports that a lot of people would be able to draw on otherwise if those relationships were supported. We found that people who were part of the workforce supporting people who had been impacted by disasters needed support themselves. Now, usually we would think about this as being people who are in traditional mental health and wellbeing services, but what we found in this research was also that the stories that came through from people who were people like tradespeople, people who worked in retail, anyone who had direct contact with those who had been affected really took on a significant burden of listening to people's stories while trying to help them, and we need to be able to support those people as well. People who are exposed to multiple disasters can also experience accumulated stress, and that's not really surprising when we think about the year that 2020 was. So for example, people in the Bega and Eurobodalla area who had experienced the awful fires that had happened a couple of months previous and then experienced a pandemic really experienced an accumulation of the stress they were already experiencing. Things that had been helping their recovery, things like being able to go in to see services, being able to see their friends and family, being able to go and do things they enjoyed, like going and seeing live music or going for small trips, all of that was taken away during the pandemic. So they had this additional layer of stress while they were trying to recover from the earlier event. One of the other key findings was that when we don't implement the lessons that have been learned from previous disasters, this was experienced as really significant frustration by people who had been affected by the more recent disasters. These people knew it wasn't the first time governments and other agencies were trying to grapple with these things and were incredibly frustrated that the lessons hadn't been implemented from previous events. So that why did this happen when we knew it was an issue question became a really stressful thing for a lot of people. One of the things participants told us, which is absolutely reflected in a lot of the literature, was that mental health and wellbeing fluctuated for them. It wasn't like it was a linear trajectory for people after the disaster events. It went up and down, and people experienced other life events as they went, which also added to that. So it's not a linear process that we're looking at with people's recovery. Participants who told their stories also told us that there were lots and lots of barriers to accessing help for different reasons. For some people, they just didn't know what services were available and they didn't know how to find out about it. For other people, they had that much else to do when they were trying to negotiate their housing, their insurance, their health issues, trying to support other people, that even though they knew their mental health and wellbeing needed support, it just kept slipping down the list of this overwhelming to-do list that they had to do. One of the other issues that other participants identified was that they just weren't sure whether they really needed help more than other people. They were worried about other people in their communities, and also a bit fearful that if they access support and services, they would be taking away from people who needed it more. A thing that came through really clearly from participants was the way services go about presenting their services is as important as the actual service they're delivering. Support services who came across as being warm and friendly and welcoming were really valued by people who have been affected, but services that came across as being judgy or difficult to access or difficult to understand, people didn't want to access their service even if they thought the service was the thing that they needed. There were practical hurdles that people were facing, and where they identified that they were able to get practical support just to get over those little hurdles, participants identified that as being really empowering. I think traditionally we've seen this in the sector as there's been a concern that people have a learned helplessness if we help them, make phone calls or do practical things to get them past these little hurdles, and that wasn't what participants talked about at all. Where people were able to fill in the form they were finding it hard to fill into, or make that phone call that they were finding really difficult to make, it just jumped them over that little thing that they needed help doing, and they got some momentum. Far from feeling like they were helpless, they then talked about how empowered they felt and how they felt they weren't alone. So from those key findings, we've got a series of recommendations from the sector. The first recommendation is that it's really, really important to use a trauma-informed, human-centred approach in everything that services do. The second one is to recognise the significance of those aftermath-related stresses and be able to see addressing those practical issues as being a mental health, not only an intervention for mental health and wellbeing, but also a preventer of mental health and wellbeing issues escalating when they could be prevented. It's really important for services to prioritise flexible, context-appropriate and coordinated service systems. So where services are able to prioritise those, we know the outcomes are going to be better for those in the communities. It's really important that services are able to make their eligibility criteria very clear so that people who have been affected by disasters don't feel like they can't access a support service if they are indeed eligible for it. One of the big findings that came through a lot of different things that participants told us was that it's important for service systems, whether it's government, non-government, community organisations, to design entry to that service support system as being as frictionless as possible. So where someone comes to approach a support service to say, I need a bit of help, rather than being told, well, we're not the right people for you, you need to go somewhere else, saying there is no wrong door. You can come on in here and we're going to find the help that you need. All services need to be supported to understand why that coordinated approach is so important. One of the really strong pieces of feedback that came through was where services were disconnected from the broader coordinated system. It made it really difficult for participants to go back and forward through different parts of that service system. So if we can support services to understand why it's so important that they're coordinated and how they can coordinate better, it'll be better for people who have been impacted by disasters. Organisations definitely need to be able to plan for service provision to go for the long term and also be prepared for delays in people trying to access the service. So when services are trying to set up, not looking necessarily just at the numbers that are in the first couple of days or weeks after a disaster, but knowing that they need to plan for months and years for when people are ready to come in. And the last recommendation that we have in the report is communication is just key. If you can get communication right about the types of information that people need and the types of supports that are available to them, we know that people are going to have an easier time of trying to get the help they need.